Hello and welcome to this National Pathology Week video. My name is Dr. Susie Lishman and I'm President of the Association of Clinical Pathologists. This series of videos on pathology myths and misconceptions was recorded as part of National Pathology Week 2024, an annual celebration of the vital role that pathology plays in everyone's healthcare. It was developed by the Pathology Alliance, an umbrella organisation of all of the UK's pathology societies and organisations. In this video, Professor Clare Rusbridge will explore the statement, "Cute dogs make great pets."
So I'm here to represent the veterinary profession. And I suppose that one of the things that our companion animals are different from humans is that they may get disease because they are a certain shape or breed. If I could have the next slide, please. So what is cute? Well, cute is very much in the eye of the beholder, but for many people, cute is miniature and brachycephalic dogs because they are certainly some of our most popular companions, with the French Bulldog being the most popular breed in America and the UK. And this is partly because people's lifestyle is better to have a miniature, small dog. It's easier to keep in a small area and perhaps requires less exercise. But also, this can sometimes be due to fashion. Next slide. And the problem is that our human nature means that we are drawn to and select more for dogs that look like babies. And this is just our human nature. We like animals that have a nice round forehead, eyes that are kind of binocular. So the dog's eyes are normally on the side of their head, but binocular means they're forward facing, that their nose is perhaps lying between the eyes when we look at it, that little cute button nose. And a very appealing expression. In fact, we've selected dogs that have eyebrow movement. Eyebrow movement is not seen in wolves, and that's because dogs have evolved with domestication because of our selection to have more expressive faces. But what is the cost to the dog? Next slide. So what does brachycephalic mean? It means that you have a short skull, and specifically refers to the skull containing the brain. But many brachycephalic dogs are also flat-faced, meaning that they have these baby-like or neotenic features. But the problem with this is that you have a reduction in the bone, not in the soft tissue. And what that means is, what is your soft tissue? It's your soft palate and your tongue and your nasal tissue and your brain. And you have a situation of a 2-pound tongue or soft palate or brain in a 1 pound mouth. You have this huge tongue which is getting obstructed. And that's what you can see in this midline section here. So this is a section through the center of a dog's brain, and it's morphing. It's been made in a CT from a non-brachycephalic breed to a brachycephalic breed. And what you're seeing there in the yellow is the nasal tissue becoming crushed. You're seeing the skull bones reduce. You're seeing the tongue get folded up and thickened, and you're seeing this, which is green, and you're seeing the soft palate, which is pink, getting folded up and thickened. And if I could have the next slide here. So this is showing that morphing in still to show you the difference between them. Now I've got a human picture there, and it shows you that because one thing that's not necessarily clear is that a human has a flat face, and people say, well, what about humans? How come they can breathe? But what you can see there is that the nasal passages, which are going through A through to H, they are all below the brain. But in the dog, they're in front of the brain. So when we reduce that face, so to speak, we give them a flat face, we reduce all of that airway. So I'd like you to look at between A and B. And what you can see is that the arrows there are going through the black area of that CT scan, and that's the airway. But in the brachycephalic breed, we can see that that airway gets obstructed. There is no clear path. And then in the C and D shows you the difference between those soft tissues. So you can see particularly the yellow nasal tissue and how crushed that is in the brachycephalic breed. And look, those nostrils are pointing vertically up to the sky. They could catch rain instead of being pointing forwards. And you also get changes in the skull with the brain being crushed, which gives headaches, and as well as the airway obstruction. Next slide, please. But what is the greatest problem? Don't advance it yet, please. Is it the breeders? Are they breeding these dogs? Is it the dog shows because they represent these dogs? Is it the kennel club? Is it the dog owners? Or is it everybody? And in particular, what we want? And social media definitely plays a part here. And we talked about normalizing before, a normal blood size sample, but that's a feature in veterinary medicine as well. We have a problem where people say, the vet may ask, does the dog breathe normally? And they say, oh, normally for a bulldog slash pug slash French bulldog, that we normalize hearing noise. I'd just like you to look at this YouTube video here. Nala falling asleep. Literally. What do you see here? Nala's quite sleepy. And then Nala quite literally falls asleep. If I could have the next slide, please. Look at the comments on this. Oh my, that's the best video ever. Oh, that baby's so adorable. She looked like she wanted to stay up and play, but she was too tired. So cute. You can read the rest of the stuff. This is not cute. This is a dog in severe respiratory distress. They cannot even lie down. They have to push themselves up to try to keep their airway open, and they eventually collapse with exhaustion. Yet this poor dog is put on YouTube, and there are many, many like her on YouTube. You just have to search for them. Dogs with toys stuffed in their mouths, or a piece of furniture stuffed in their mouth so they can fall asleep with their mouth open. Yet we normalize it. We don't recognize these signs. Can I have the next slide, please? Some of you say, well, I would choose an ethical breeder. And I would ask you, what does an ethical breeder actually look and behave like? I asked AI to generate me a picture of an ethical breeder with happy dogs. And this is what was generated. But this is where we normalize abnormal behavior. It is not normal for a dog to breathe with their mouth open. Yet many people would look at this image and interpret them as a dog's being not wide-eyed and showing the whites of their eyes with distress, but laughing. And again, we need to understand a lot more about dog behavior. Can I have the next slide, please? We need to redefine what normal, using that word in, is and healthy actually is. And that's what actually the Swedish Kennel Club and the Dutch Kennel Club are doing. And they've just last week produced these pictures. This is what they think that the French Bulldog, that's the line drawings, and the Bulldog should look like. And I would say to you that we all, Joe Public, need to redefine what we find acceptable as a normal dog, instead of looking at some of these images and thinking that this cute little sentient being is acceptable. Thank you very much.
I hope you enjoyed learning the facts behind that myth. You can see more of these videos on the Royal College of Pathologists YouTube channel at I Love Pathology.